Even before healthcare reform was steamrolling, one of the things that was already out of the gate were employers, in order to save costs, were introducing high deductible plans for employees. So, for example, in my family, I think we have a $3,500. We may even have a $5,000 deductible, which means basically we pay the first $5,000 before the insurance kicks in. What happens is that allows our premiums to be less. Now, with healthcare reform and the healthcare exchanges, these high deductible plans are probably going to become the norm, even though many people early on said they're going to die a slow death. Well, they're not. They just make economic sense in these times. So it's really important as these exchanges start rolling out and people who are uninsured that are now shopping for plans understand the plan. So you really need to understand the plan, understand what's covered, understand what's not covered, understand the deductible you'll have to pay or the percent of coverage, and you need to ask a lot of questions. You also need to inquire about cost. Get cost before you schedule an appointment with a provider or a procedure, and understand your responsibility. You also may want to work with the plan manager at your employer, or try to work and find out from the insurer and from hospitals what their costs are. Always, as they recommend, choose in-network providers, because when you choose out-of-network, it usually costs more. And one thing I would recommend that we've done, and we're really just trying to stockpile money in this to look forward for when we may not have employer-based coverage anymore, is a health savings account to cover that deductible, so that you have that money waiting. So high deductible plans are going to become more of the norm. Do some homework around them, understand them better. Thanks.
The ultimate goal of healthcare reform is to ensure that all Americans have access to health insurance. Beginning January 1st, 2014, the Affordable Care Act will require all U.S. citizens and legal residents to purchase qualifying health coverage or pay a penalty based on income. Exemptions will be granted for financial hardship, religious objections, American Indians, undocumented immigrants, and individuals in prison. Individuals will also be exempt from coverage if the lowest cost plan option is more than 8% of their income, or if their income is below the tax filing threshold. In addition, individuals who are uninsured for less than 3 months will not be penalized. For all others who are uninsured, penalties will begin in 2014 and increase each year until 2016, when the mandate is fully in effect. In 2014, the penalty is the greater of 1% of taxable income, or $95. For every year after 2016, the penalty will change to reflect the cost of living adjustment. To help individuals comply with the Affordable Care Act, the government has created premium tax credits and cost-sharing subsidies that may be available for people earning between 100% and 400% of the poverty line. The premium tax credits are available to individuals and families who are not offered affordable and comprehensive coverage through their employer and have an income between 133% and 400% of the federal poverty level. The premium tax credits will help individuals purchase insurance through state marketplaces in 2014. There are also cost-sharing subsidies available for individuals and families with incomes less than 250% of the federal poverty level. These subsidies will lower the amount of money individuals have to pay out of pocket for coverage. You can find more information on the individual mandate provision on the U.S. Department of Health and Human Services website, healthcare.gov.